I've always been interested in people, and I suppose, as a person with some compassion, you see people going through hard times and you want to make a difference. And I think both medicine and research work together for that. I'm an infectious diseases and microbiology trainee, and one of the more challenging group of patients that we treat are people with bone and joint infections. Bone and joint infections can be really painful. These are problems that people have over a very long period of time that can leave them feeling unwell, losing weight, unable to work, and in rather a lot of pain. The study that we're doing at the moment focuses on antibiotics. We wondered if implanting antibiotics directly into a bone or joint could spare people the side effects and the downstream effects in terms of antibiotic resistance of having antibiotics for that long. So the study that we're currently doing is a trial comparing shorter antibiotics for less than a week against longer antibiotics for the usual amount of time for people who have had surgery for their bone and joint infection and have had antibiotics implanted directly into the bone or joint. And I think it's one of the great success stories of microbiologists, so infectious diseases specialists, working together with our orthopaedic surgeon and plastic surgeon colleagues to all address their parts of the patient treatment pathway at the same time. We are very grateful for the opportunity to receive the Kathleen Harper BMA grant to support our research into antibiotics, because it will help us to address a question that would not otherwise be possible to address, that really benefits patients and society by trying to reduce the problem with antibiotic resistance. It's really, really helpful for people in my position having access to grants like that, especially when you find out within a reasonably short space of time whether or not you have the funding. It can be tremendously helpful in terms of planning for the research. Doing medicine, you see people get better, you see some people really having a rough time with their treatment, and you see people who don't get better from, in my case, infections and other problems that they might be having in their life. And you think, can we do something better? Can we really improve the care that we give to people? And I think the only way to really address that is through research. One of the really important things that we did at the outset of the study were talk to patients about what it was that they wanted from their treatment, what the major problems were, and to be able to address that question, as well as thinking about the wider costs of antibiotics to society, has been absolutely brilliant. We have to bring research to the bedside. We have to give people an opportunity to be involved in research studies. We know that patients want to be involved in research. I'm certainly really grateful for any patient who considers taking part in medical research, and I'm very grateful for anybody who considers funding research through charity, because I think it really makes a difference to people.